We often think of access to healthcare as a simple binary issue. We either can access it or we can't. But ultimately, the perspectives of patients whom I've met proves that this is a much more complex issue. I'm so sorry, sir. We're all booked out for new Medicaid patients for the next few months. I disappointedly informed a man over the phone. It was summer 2022, and I had just finished my training as a new medical assistant at a dermatology clinic in Colorado Springs, Colorado. It was a small clinic operated by just a single physician, and our schedule was booked. We just didn't have any space available for especially patients who were on his type of health insurance. But the man on the phone said he hadn't been able to get in anywhere else, and he had a seeping, really bad skin infection in his leg. So I refreshed the schedule, and I was able to find a slot available for the very next day, and contrary to our policy, I decided to add him to the schedule. The next day, the man came in for his visit, and he was in really bad shape. He had an infection on his right leg that was spreading up to his neck. He had fluid buildup on both of his legs, so much so that he couldn't properly walk. He was not doing well. But thanks to the timely care of our doctor and thanks to modern medicine, he was able to improve rather quickly. He called me on the phone about a week and a half later while I was at the clinic, and he said, I noticed an incredible improvement, and I'm so grateful for the care of the clinic. But more than that, he was grateful for being able to access medicine. Now, Medicaid is a specific type of government insurance that treats low-income Americans. These Americans are unable to get or afford care generally, but Medicaid patients can come into clinics just like commercial health insurance. However, this doesn't pay doctors the same rate as commercial insurance. So doctors generally put a cap or limit on the number of patients that are seen by their clinics. This makes it very difficult for patients to actually access the healthcare that they need. And thinking about this patient who I met, he might not have been able to even come into a clinic, and who knows what would have happened if he hadn't been able to see us at the clinic that day. A few months before my time at this dermatology clinic, I was actually shadowing a physician at a terminal illness clinic in Hyderabad, India. We dealt with patients who were on very low income, and generally they made less than half a KD per day. They didn't understand the scope of their condition, nor did they understand how to properly treat their disease. And so we had to ensure that they got the care that they needed. One day, a 22-year-old female patient was walking up the steps of the clinic, and I looked out the window of the clinic and saw she had two young children with her. One was maybe about 10 months old and the other about 3 to 4 years old. She hobbled up the steps, struggling and taking a breath up every single step. She was clearly in really bad condition. When it was time for her visit, she came in and she couldn't speak above a whisper. She was in really, really bad shape. The doctor and I were unsure if she would make it to that day or the next day. So we immediately called an ambulance, and we said, and the doctor said she needs to get taken to the emergency room right now. But going through my mind was, how is she going to be able to afford the care that she gets at this hospital? This is when I found out that in India, the government hospitals pay for all patients regardless of their ability to actually pay for their treatment. They do this by ensuring that doctors get paid the same no matter who comes in and no matter what insurance the patient has. This leads to patients truly being valued as people and truly getting the care that they need when they need it. Now, these two stories, these two perspectives of the patients I've met are very different. There's one patient in the US who you would think would have easy access to healthcare, who would be able to get the best treatment with the best machines and equipment and all of those things, best medicine, while the other patient in India might struggle. But the story is flipped. In reality, the patient in the US couldn't get in while the patient in India knew that she was cared for. I believe that we need to consider healthcare as a right that everybody can access. Now, even in countries that have universal healthcare, it's still an issue because we still need to consider things like wait time, things like deductibles, premiums. All of these things still need to be at the forefront of whenever we think about access to healthcare and medicine. I believe that if we can continue to consider healthcare as a privilege like we do in the United States, we will end up losing out many patients and not getting them the care that they need. So we need to consider it as a human right everywhere. From the perspective of an Indian American who has seen both care in the US and in India, I believe that in order for us to have truly equitable healthcare, we need everyone to be able to access it, no matter who they are or where they are. Thank you.